Hi everyone, I am Dr. TM and this is the Medical Truth. I hope you're having a very splendid week. It's a beautiful Thursday morning and I thought we could sit down and talk about a very important mental health disorder, and that is obsessive compulsive disorder. Yesterday I posted a question on my page. I said, what exactly is obsessive compulsive disorder, OCD? Many people have this erroneous belief, this wrong belief that OCD, that's obsessive compulsive disorder, just means that the person always likes to be clean at all times, every time. Is that really true? So what exactly is obsessive compulsive disorder? Obsessive compulsive disorder is a mental health disorder in which a person feels the need to perform certain routine or acts repeatedly, or has certain thoughts repeatedly. In which case the thoughts, that's the repeated thoughts, refers to your obsession, and then the acts, the routine, refers to the compulsion. We call it obsessive compulsive disorder because the thoughts occur before the compulsive acts. They have the thoughts and then they go ahead to do the compulsive acts. So we call it obsessive, that's the thoughts, and compulsion, the acts. We find that these persons who have OCD, they are relieved or they find relief after the compulsive act has taken place or has been performed, and they are not able to control their thoughts, their acts for more than a short period of time. And when they do not engage in that compulsive act, they will never find relief and they will never be at peace with themselves. They will always feel that something is wrong until that act has been performed. Now, what are the examples of this compulsive act? Frequent hand washing. One person has washed his hand with antibacterial soap and hot water, and then goes ahead to wash his hand several times after. His or her hand several times after. And some of them, because of that, the hand now becomes very red and raw with dermatitis and skin infections due to excessive hand washing. Sometimes counting of things, something that's already been counted, we find them counting that thing several times after to be sure that it has been counted properly. Or checking the front door. If the front door is locked, they check the front door the first time, it's locked. They check the front door the second time, several times, frequently after. Those are compulsive acts or examples of obsessive compulsive disorder. Another thing is that these acts could take more than 1 hour of a person's time. And one thing about obsessive compulsive disorder is that it affects a person negatively because there's always an increased risk of depression and suicide associated with the disorder. Who are those affected by obsessive compulsive disorder? Obsessive compulsive disorder has no gender selection, or is not gender specific. It can affect both males and females equally. It's not like only females are affected or only males are affected. Both gender are affected equally, and it occurs before the age of 20 and becomes even worse after the age of 35. What are the risk factors? What makes a person more likely to have obsessive compulsive disorder? Genetics. Most mental health disorders run in the family. If one member of the family is affected, another member of the family will also be affected. Family upbringing is also a major risk factor. Child abuse. An adult who has been abused as a child is very likely to develop OCD later in life. Bullying, relationship problems, drug addiction, drug abuse, these are risk factors. Another thing, like I mentioned in the beginning, is that obsessive compulsive disorder, the mentality that obsessive compulsive disorder is always associated with cleanliness, is wrong. These obsessive thoughts, they could also be sexual in nature, meaning that this person has sexual thoughts or finds himself watching pornography, fantasizing about sex, and then the compulsive act is masturbation. That means the person has these sexual thoughts, dwells on these sexual thoughts, and then compulsively masturbates after. That is an example of obsessive compulsive disorder. Also, the person may have violent thoughts, may have religious thoughts. Sometimes they engage in very strange acts like hair pulling, hair chewing, skin picking, nail biting, strange acts that are compulsive. One other thing about obsessive compulsive disorder is that persons with this condition, they try to rationalize their behavior, they try to justify their actions even when their actions are not right. For example, a person that checks the front door every now and then tells himself that the stress I will go through in checking my front door every now and then will be less than the stress I will go through if I'm actually robbed. That means the person is trying to say that he's trying to be protective of himself, he's trying to check to be sure that his door has been locked to prevent himself from being robbed. But if you have checked the first time and the front door is locked, why do you have to check several times after to make sure that your front door is locked? That is where the disorder comes in. Now, what are the problems associated with obsessive compulsive disorder? Depression, like I mentioned earlier, suicide, eating disorders, personality disorders are associated with this condition. What to do if you have these symptoms like I talked about? You talk to a mental health professional, you talk to a psychiatrist, a psychologist, a mental advocate such as myself. Talk out your feelings, talk out these symptoms, and then based on the discretion or depending on the discretion of the doctor, he will counsel you, or he or she will counsel you and then prescribe some medications for you, either an antipsychotic or an antidepressant or both. I'm not saying you should start looking for antipsychotic or antidepressant if you have these symptoms. No, the first thing is to see a doctor, talk to that doctor, you will be counseled, and depending on the doctor's discretion, depending on the dosage of the doctor, you will be prescribed these medications. I hope you enjoyed this topic. Please feel free to send in your comments, your questions, and your contributions. I remain Dr. TM, and this is the medical truth. No more lies, just tell the truth. Thank you for watching. Bye-bye.